Martine.
Yes, Martine Picard, I'm from Brussels, Belgium. I agree that exercise and food could be important to decrease your risk of breast cancer, but personally, I got very impressed by a wonderful lecture at the San Antonio Breast Cancer Symposium last year by an epidemiologist from the UK. And she gave very strong arguments to say that the most dramatic way to reduce the risk of breast cancer would be to go back to a very early pregnancy, full-term pregnancy in life, multiple pregnancies, and long breastfeeding. And she made a simulation, and she showed that this would have a much more dramatic impact than reducing alcohol or eating more vegetables. So my question, this is not very practical for women to do.
I wanted you to acknowledge that and not make me. So thank you very much.
So my question is there a laboratory scientist somewhere in the world who is trying to synthesize a pill that would mimic these important changes that are brought to the breast by pregnancy and breastfeeding?
Boy, I'll tell you, at first blush, how many women would like to feel continually pregnant for... So it would have to have selective effects, let's just say. So that's a challenge that will go unanswered, I'm afraid.
No, it's true that, say, first pregnancy under age 18 is maybe a lot lower than after age 30. The problem with that, first of all, there are many reasons, as we have women's movements which we need across the world, not just here, to allow educated women in more jobs. The problem is you'd have to give very high dosages to get up to the level that a pregnant woman has, and there'd be a great reluctance to do that. So I don't know how you would do that.
I think the Russos, Emma and Jose Russo, actually have been looking at this question for several years, but I think they put it down to gonadotrophin differences rather than the steroid hormones, but I don't think they've come up with any product, you might say, that can be a pill for the future. It's
tricky, and Malcolm Pike had other studies, but was essentially knocking out your hormones and thinking we could do better. And seems strange to me.
I just want to highlight something for everybody in the audience. This little exchange, which was a very brief version of what we did yesterday, is an example of exactly what BCRF enables us to do. A very straightforward but scientifically sophisticated question, and a large number of people who actually have access to maybe the beginning of the answer. And who knows, maybe from this discussion, work will follow.
It would be nice, but it'll take a lot of study.
And I mean, really to extend that very, very important point is that yesterday in the scientific symposium we had before, we had divided up 6 groups. There were a lot of ideas and a lot of new data presented that had not been presented before. You know, and the idea of forming a very large community to answer these questions is very important from a scientific point of view. You know, and you've heard other sessions that we've had here over the years about molecular biology and other kinds of topics. I mean, I think to me the key question is, you know, assuming that it's true, and I think that it's a fairly safe assumption at least to move forward. The question is why, and what is the trigger? Again, it's the analogy of spilling. Spilling the glass of beans is what is actually triggering that. And so a very early event such as early pregnancy can have lifetime benefits. Is something that the other side of our research endeavors involving molecular biology, stem cell biology, and other topics is something that we really can address, because you may not need to have a kind of a false hormonal pregnancy. There may be something else that's triggering it that we can actually find. Genetic factors may predispose in terms of prevention or causation in this regard. And that is why, again, if you're interested in not having to worry about cancer, do all the right things, but also you've got to support this research.
Thank you.